Hello, my name is Dave Scheuer. I'm a health educator with Security Health Plan, and today we're going to take a closer look at our digital health coaching programs. Okay, our goal today is to help you understand what is a digital coaching program, how to complete one, which coaching programs are available for you, and how you can find additional resources to help improve your personal health and wellness. Digital health coaching, what is it? It's a combination of advanced technology with science behind it that simulates a health coaching interaction, and it's done over the web. Drawing on the experience and expertise of healthcare professionals, it also applies the best practice and latest scientific research and evidence to help people lead a healthier lifestyle. It also creates a personal action plan for each participant, and a nice feature of digital health coaching is that it's available on your schedule, since it's available 24 hours a day, 7 days a week. The first step in completing a digital health coaching program is to register for Security Health Plan's online portal. And you can do that by going to www.securityhealth.org. And in the upper right-hand corner of the page, you'll see a purple box that says My Account. Go ahead and click on that box, and then you'll be able to register. And if you have your Security Health Plan membership card, you'll need that information to complete the registration process. And once you register, you will receive your username and temporary password in the mail in about 3 to 5 days. And once you receive that username and temporary password, you go back to the Security Health Plan website and click on that purple box again, My Account, and enter in your username and temporary password. Once you are logged into the portal, you'll see a page that has your personal information, and a little bit further down on the page you'll see this box that says Life Focus. Go ahead and click on that box, and then on the next page there'll be an orange button that says Health Assessment. The health assessment is the first step in completing a digital health coaching program, because you need to complete the health assessment before the health coaching programs become available. It's important because the health assessment looks at different lifestyle behaviors and can then recommend digital health coaching programs based upon your needs and your motivation to make changes in those areas. Once you're in the portal, you can see at the left-hand side there, bottom left, there's 2 tabs. The first one is My Health Assessment, and the second is My Health Programs. If you have never completed a health assessment, that first tab of My Health Assessment will be the one visible. Once you complete a health assessment and come back into the portal each time, the My Health Programs tab will be available. You go ahead and click on that, and you'll see a list of different health coaching programs that you can choose from. And the first program I chose here for the demonstration is the Nourish Plan, and that takes a look at healthy eating behaviors. And what you want to do is click on the Start Consultation, and it'll begin to ask you a series of questions that take a closer look at your nutritional habits. And if you look on the top left there, Consultation, it will also give you an indication of how far along in the assessment you are. And with this assessment and the others, once you answer the questions and click Next, it will automatically save those responses. So if you are unable to finish all of the questions in one sitting, you can come back at a later time and pick up right where you left off. And all of the questions, clear, easy to read, a number of pictures that are available to make different options very easy to choose from. And there's also smart features where when you complete the health assessment, some of the questions are very similar. In the nutrition part of the health assessment, it asks you how many cups of fruit do you eat per day, how many cups of vegetables. And it will automatically take your responses from the health assessment and enter those into the digital health coaching program. You still have the ability to change that answer. but if you see a question that's already pre-populated, you can look beneath to see where that question came from. It could come from the digital health, another digital health coaching program, or the health assessment, and it provides you with the date that that question was answered. And once you finish the consultation, you can click Submit, and the program will automatically generate a plan for you. And this is a screenshot of the plan. It goes through step by step what you can do, especially in the Nourish program here, looking at nutrition, knowing the facts, how to stick with your program, steps you can take to move forward. And with all of the programs, at the bottom there's a printer-friendly plan. The plan is always available to you within your portal, but you can print it out and take it with you if you'd like to read and keep yourself up to date with the information that you've entered into the program. Also, there are different types of tools that you can use to help you stay on track. And there's a step-by-step tracker, and that's good for tracking activity. You can also track biometrics if you're regularly taking your blood pressure or taking cholesterol testing. You can enter those variables within the tracker and watch your change as you move through the program. There's also different libraries in there that take a closer look at exercises that related to strength training, stretching, relaxation information. There's also cookbooks with recipes that look at specific recipes that can lead to lower sodium intake, or also if you have to eliminate certain types of foods. If you want an all vegetarian type diet, you can certainly look at different recipes that fall into that category. And then there's also further reading. The library of health information that goes along with this program provides thousands of articles and current information that you can check out. And if you look at the bottom there, it says check-ins. A nice feature about digital health coaching programs, as well as the health assessment, is that they provide check-ins at 30, 90, and 180 days after you complete an assessment. And these check-ins are evaluations to get your feedback not only regarding the program, but also to check your status. It's like a health coach giving you a call a few weeks later to see how you're doing, how things are going with your plan, and to get your feedback. These evaluations you'll receive them in your email with a link. And by clicking that link, you'll be brought back to the Security Health Plan homepage, where you'll have to log in using your username and password to get to the check-in. Along with the check-in, there are also different newsletters that you will receive via email as well. So these are just ways to keep you engaged in the program and measure your progress as you move through it. So you'll want to check your spam box, and if you see a message that comes in, it would be from our vendor Health Media and Wellness and Promotion. Or prevention, I'm sorry, where the check-in would come from. And it's basically just a link back to the website, because the information you enter into these assessments is private and personal to you. That's why you're asked to log in through the portal, so no one else can access your information. And now we'll take a closer look at what coaching programs are available. There's two different categories, one that looks at chronic conditions, and the other that looks at wellness programs. And the first program here we have is called Achieve, and it's a program that looks at maintaining a healthy cholesterol level. It also incorporates the importance of living an active lifestyle and having an effective communication with your healthcare team. The next program, Breathe, looks at those barriers and triggers that people often have for using tobacco, and it provides that ongoing support in those check-ins. It looks at your specific triggers and ideas that you have and how you can make it through those times. The other programs in the chronic condition area are Care for Your Back, which assesses risk factors associated with back pain and the steps that you can take to not only improve strength, but also look at what types of objects you're lifting and how to use proper lifting techniques to avoid aggravating a back condition. And it also looks at the stress pain cycle, and also with all of these chronic programs, keeping that connection with your healthcare provider and what types of questions you can ask for more information. Control for your blood pressure. And this is a behavioral program focusing on blood pressure, looking at the different types of treatment, looking at stress management, all of the different factors that go into managing blood pressure, including diet and physical activity. And if you are using medications, are you using them properly per your doctor's recommendation? Wellness programs available. The first one here is Balance. It's a weight management program, and it addresses a holistic approach where you're looking at not only mind, but body and food and that relationship. And it works with individuals to come up with a plan to help them maintain that healthy weight through that incorporation of physical activity, managing the diet, as well as the stress connection as well. MOVE is a physical activity program, and it looks at those barriers people often have for not being active and finds different ways based on your response to the questions on where you can fit activity in during the day. One of the questions with this program even looks at, do you have pets? Do you have a dog? Is that something that you can integrate into your day to get out for a walk with your dog, which would benefit the two of you? And also it takes into account your motivations and how important this is, and also the confidence you have to make changes in this area. And with all the digital health coaching programs, it will ask you to rate your motivation on a scale from 0 to 10, with 0 being low motivation, 10 being high, and also the same with your confidence to make change. And it will take that information and integrate that into your plan. So if you have a high motivation to make healthy eating changes in the Balance program, maybe not too much in the physical activity, it can kind of move you in the direction that you're going to find the most success in the beginning and then gradually incorporate all of those other variables into your plan as well. The next program, Nourish, is a healthy eating program. It takes an in-depth analysis of what you currently are eating, and it simplifies nutrition to look at the healthy food choices that you can make. Often we get so confused in looking at what specific diet plan we should use. Nourish takes a look at providing that individualized nutrition plan using simple food choices, looking at fruits and vegetables, lean cuts of meat, and putting that into a program that's easy to follow. There's also the Relax program, and this is a stress management program. Again, the important thing with stress that this program pulls out is identifying those triggers of stress. What is in your lifestyle that is causing you to become stressed? Often we're so involved with the symptoms, the nervousness, or maybe it's overeating or undereating, that we never really get to the root cause of the stressors. So this plan takes a step back to identify those stressors and then puts together an action plan based upon what you feel would be beneficial. It also provides some recommendations on different ways that you can either improve those life situations, and sometimes we can't change what is causing the stress, and we have to look at ways that we can address those stressors or de-stress, whether it's reading a book, taking a walk, or doing any number of different types of activities to manage our stress. So that's a closer look at the digital health coaching programs. I also want to share that along with our online digital coaching programs, we have telephonic health coaching. And if you're using a digital health coaching program, maybe you might have questions regarding the plan itself. We encourage you to call Security Health Plan and talk with one of our health coaches either about your current plan, or maybe you're looking to make some changes in other areas as well. And you can do that by calling our customer service number at 472-2363 and ask to speak with one of our health coaches. We also provide these wellness webinars, which are posted on our website as well at securityhealth.org, and we welcome you to come and look at archived webinars that we've had in the past. We also offer a monthly Life Focus e-newsletter that addresses different topics regarding wellness and provides program updates. And along with our wellness coaching programs, we also have nurse care managers who work with members who are diagnosed with specific conditions who are interested in additional help. So those people may have diabetes, congestive heart failure, hypertension. Our care managers are available to work with those members interested in making changes in those areas or just getting more educational information. And all of this starts by completing the Life Focus health assessment and answering those questions, looking at those lifestyle behaviors, and getting that report that provides feedback in areas where you're doing well and also areas where maybe there could be some more improvement, and tapping into some of these resources to address those. And there's much more that we have to offer. Now, if you have any questions or comments regarding the presentation, please feel free to use the chat box at the bottom of your screen. And I thank you for your time in listening to the program.
Hi Dave, my name is Angie, and I just wanted to follow up. I'm a fellow health educator here at Security Health Plan. And as you were going through these digital health coaching programs, I know that there's such a variety that they can touch variety of people in many ways because they're so specific to so many different wellness areas that someone may be interested in focusing on. Is there a limit to how many digital health coaching programs somebody can do?
Members can complete as many digital health coaching programs as they would like. Typically, after completing the health assessment, you might get 1 or 2 recommendations. And within the health assessment, if there is an area where the program feels you could probably use some change, it will ask you those motivation questions. You know, how motivated are you to make a change in this area, and how confident are you that you can make a change? And then it'll give you 1 or 2 digital health coaching programs that you can access. And you can take those recommendations, or you can choose from any of the other topics that you're interested in. But there is no limit to the number of digital health coaching programs that you can take, and they're available to you one time each year. So if you complete a digital health coaching program in May of this year, you will be able to restart that program again in January.
That's a great point, Dave. That also is a great reason to come back and take your health assessment each year, because then you can see from year to year how things are changing or improving or not, so that you know where you can better focus your attention. With that said, have you ever heard of anyone taking the results of either their health assessment or their digital health coaching pieces to their providers?
I personally haven't heard of someone who has taken it in. However, that is something that we do encourage members to do, because it gets that conversation started with your provider. Sometimes when you go in, you're taking a look at, you know, are you on track for your immunizations or your blood work or what have you. The health assessment takes a closer look at those lifestyle behaviors that can impact those numbers. So having a discussion with your doctor about those health behaviors and getting their input and feedback can be a very beneficial, the health assessment can be a very beneficial tool in that process.
The other thing that I know in working with this digital health coaching program is that it's closely tied to scientifically based outcomes, so that we can prove that people have been able to change using these programs. So I'd highly encourage you to take a chance, take a moment to check it out, see what it can do for you. Like Dave mentioned earlier, it's a great opportunity to get involved with your wellness on your own time, whenever you want. It's not restricted to the amount of times you utilize it as far as accessing your one digital health coaching program per year. You can access it multiple times. So keep coming back, see what Security Health Plan has to offer. And I just want to say thank you, Dave, for sharing this information with us. Health educators here at Security Health Plan are always available to help walk you through these steps if you ever do get stuck, as well as to help you walk through your personal wellness if you too feel stuck with that. So don't hesitate to contact us. And with that, I just want to say thank you, Dave, again. And I think we'll round things up for today. Thank you for your time, and thank you all for listening.